So one of the top questions we get asked about living in Mexico is how we handle healthcare. There's different ways that you can do it. The route that we've chosen is this. I'm 55 and my husband is 57. We have purchased an insurance plan in Mexico through a company called VUMI, V-U-M-I. And I will say that by far it's our biggest expense monthly. We pay about $1,000 a month, and it's a $5,000 or $6,000 yearly deductible. Our reasoning behind it is this. Because we're that age, we're scared of that big diagnosis. And we want that coverage to be there if, God forbid, we need that. Because there's that $5,000 deductible, we're really not going to see our insurance kick in for our day-to-day needs. So, and we found that going to see a doctor, you've got a bug, you hurt yourself, whatever, an office visit is usually between 500 to 700 pesos. So that's like $25 to $32. Very affordable to go in. So we just pay everything out of pocket. Last year, my husband needed to have eye surgery. He needed to have his cataracts replaced. And we ended up paying that out of pocket because it was under the deductible. And he paid $5,000 for the surgery, 2 surgeries, one eye 1 week, one eye the next week. We've been really, really happy with the medical care here that we've received. The plan that we have also covers us throughout the world. Now, we wanted to add on the U.S. to be able to cover us in Mexico and U.S., but the way their plans are written, it just was rest of world. So, and then it also has a clause in there that if there's need be, they will fly us to the medical facility that we want to go to. So it's $1,000 a month. That's, like I said, it's our biggest expense, but for our purposes and our use case, for us, it's worth it. Other people that we know do it different. A lot of the friends who live here part-time tend to have insurance up in the States, and they do all their medical care in the States, and then they'll just pay out of pocket for they get a bug down here. My friends who have Medicare, Medicaid have told me that they can't use it down here. So the full-timers down here, if something comes up, they'll just plan to take a trip up to the States for a couple weeks to do any medical treatment they have. And then just like us, they'll pay out of pocket for the day-to-day medical needs. Our experience has been very positive. I'm always curious how other people handle that, because personally, and I think I'm not alone, as we've gotten older and thought about retirement, the biggest freaking unknown and the biggest fear that we've always had has been healthcare. So for us right now, the setup that we have and what we're paying is giving us the peace of mind. Maybe in a few years it'll change, but for now it's really what works for us.